Welcome back to 5-Minute Life Hacks. This is your host, Natalia Ambrosia, coming at you from my Airbnb in Puerto Escondido, Mexico. If you're new here, I'm a health coach, and each week I give you 5-minute life hacks to help you live your best life. Occasionally, I'm traveling and in an Airbnb. So welcome. Let's get started by taking a deep inhale through the nose and an exhale through the mouth. Today's episode is about MDMA-assisted therapy, what it is, and my experience with MDMA. Before I get started, though, I have to tell you, I'm just your friend telling you about my experience, my opinions, my research. I'm not condoning anything. I will pop links in the captions for you to read more. And of course, you can ask me any questions you like. But now that that's out of the way, let's get started. I know what you're thinking. MDMA, you mean ecstasy, Molly, the party drug, therapy? Yes, actually, MDMA was created by Merck Pharmaceuticals at the start of the 20th century in their quest to create another drug. It was one of their iterations. They didn't end up using it, but it was rediscovered in the 1970s by a group of psychotherapists who started using it to assist them in their treatment of PTSD patients. They were finding that it was working quite well, but eventually in the 1980s, it got released into the world and became ecstasy, the party drug, and eventually it was banned. But for the last 30 years, Rick Doblin, along with maps.org, look them up, have been working and researching, and hopefully by the end of 2022, MDMA-assisted therapy will be approved for the use in the treatment of PTSD. However, it's really expensive. They're also trying to have MDMA regulated so that individuals can purchase MDMA for their own use. So look out for that. Now, let me talk about my experience. So now I will talk about my experience with MDMA. I'm a very precocious person, especially when it comes to anything altering my mind. Even pharmaceutical drugs like antidepressants, anti-anxiety medications, I'm always hesitant. So I came to MDMA later in life, in my 30s, after having done a lot of research about the therapeutic benefits with PTSD, trauma, anxiety, depression. So I decided to try it in a very controlled environment. And after the first time, I found it so beneficial that I have since tried it a handful of times, always spaced out, like no more than, at least 3 months apart. And I have really found the benefits to be incredible in my therapeutic journey and very lasting. So what I feel with MDMA is it feels like a deep breath. I don't feel exactly like my mind is altered. I feel present in my body, like I can feel everything around me. I can see it, I can smell it, and I can hear it, and I am present. I'm always in my head. Like always. So for me, meditation or being present is really hard. And with MDMA, I feel like I can be present in my body and let go of my ego. And it is in that state that then I can work through any emotions going on in my body. And I can afterwards write them down and work through them for the next few weeks, months, and so on with myself and with my therapist and with my friends and through my meditations. And so I also love it because that feeling of presence is like a muscle memory. Even now, as I talk about it, I can feel myself getting into that meditative state. So the effects are lasting. I've never used it just as a party drug. I've never actually used it as a party drug. I've never really drank with it. I think once I did have a drink with it, but that is all. Usually what I do is I set an intention. So usually it is to feel my body, to feel the emotions coming through. I pull a tarot card and I do it with friends that I feel comfortable with, in an atmosphere that I feel comfortable with. I do it during the day. I do not drink. I have water around me. There's a designated person who is there for us to take care of us. And I also hold a space the next day to relax, enjoy, journal, and then I talk to my therapist for the next week or so about everything going on for me and all the revelations I had. And I really feel the therapeutic benefits are incredible for me. And so it's been really great. But I do see that there's a dark side because obviously this drug is unregulated. Some drugs like MDMA can be called ecstasy and have added fillers because we don't know exactly where it's coming from, which is why Rick Doblin and MAPS is working to regulate the drug so that people can use it for personal use and have these therapeutic benefits. But Don't get me wrong. I know it can be scary. You need to trust your source as much as you can as well. Also, I don't take more than 100 milligrams, and I make sure that I don't take anything more than that. And I make sure that, I'm not just depleting my serotonin, that I'm taking my proper supplements. So it is a lot to think about. And so I also know that it's a very taboo topic talking about this. So I appreciate you listening. I'm going to end there just because it is a short episode, but I want to hear your thoughts, your experiences, what you think about this episode in case you hadn't thought about it. As always, message me at Natalia Ambrosia on Instagram. I love hearing from you, sending you lots of love, lots of light. Have a wonderful day now. I'm off to the sunset. Bye.